Overcoming a breakup might be a difficult process to go through. And realistically speaking, after meeting with all the patients and clients, I realized that they don't have the proper tools to go through this process. I tried to make it as simple as possible for everyone to understand how to overcome this difficult time. I tried to design the ultimate guide to overcoming a breakup. I realized that a lot of things are not spoken about in the realm of YouTube and even in the books regarding how to overcome a breakup realistically. I'm Dr. Yousef Hassan, medical doctor, founder of the Realistic Psychoanalytic Approach, best-selling author of 3 Arabic books. And now we'll start. The first step of overcoming a breakup is the realistic analysis. You have to realistically analyze what happened to you in the process. Without this essential step, it's difficult for you to understand how to overcome a breakup properly. What do I mean by realistic analysis? It's basically trying to see reality as it is. What actually happened in the process and in the relationship. Why did it end? How it ended? Was it your fault or his fault? It's very difficult for people to understand because people, they measure upon their personal experiences when they analyze what happened, and they might feel guilty when in fact the problem was from the other side. For example, if you were with a covert narcissist who was manipulating you throughout the relationship, but you weren't able to understand the emotional manipulative techniques that he was using. So you might analyze the whole thing according to what he said about the story. You might think that you actually belittled him, or you didn't do enough, or you had to prepare yourself more for relationships, when in fact the problem was he was actually deceiving you to use you, either to use you emotionally, sexually, financially, or for other purposes. I always tell my patients, it's not what you think happened that matters. It's what actually happened that matters. And they usually are confused. What do I mean by that? Whatever we perceived as reality might be wrong, because either if you were with a covert narcissist or if you were with someone else who has certain complexes that makes him toxic in the relationship, and you wanted this relationship to work, and he was the one who initiated the breakup, you might be looking for mistakes and faults within yourself and capitalize on them, instead of looking at the story from a holistic perspective. What actually happened? What did I do? What happened in reality? Where are my mistakes? And what is the other person's mistake? And here you'll be able to analyze properly and see through what happened without deluding yourself. Many of us in the breakup phase might live on the fact that we did a mistake, we lost someone, why did this happen? And we keep wondering and wondering. A lot of patients, they kept blaming themselves. The other section of the patients, they might be blaming the other person instead of looking at themselves. So I always tell them, keep the mirror on instead of just allowing the magnifying glass to work and operate on the other person. So you have to understand that you have to balance the view between the mirror that shows you your mistakes and what did you do wrong, and the magnifying glass that shows you the other person from realistic lenses. Realistic analysis will save you from self-deception, from being or living in an illusion, from thinking that you did a mistake that you didn't do, or from blaming the other person on certain stuff, but in reality you were the one who was mistaken. The word narcissist has been thrown around in YouTube all over the place without a clear definition. And I wouldn't go with the DSM definition of the psychiatric diagnosis of narcissistic personality disorder. Actually, I don't consider it a disorder myself in my clinic. I see that people in the spectrum of narcissism and empathy, they fall into percentages. Some people have the percentage of narcissism more than empathy, and the other way around. In simpler terms, a narcissist is someone who is selfish, who thinks about himself first in a negative way, in a way that he might even harm other people to get what he wants. He is manipulative, he thinks about his needs first, he takes his needs through manipulative ways, hence the name emotional manipulation, someone who tries to get his needs through manipulation. And I'll make a whole video about all the emotional manipulative techniques that I see in the clinic. And if you guys are interested about it, you can write me in the comments what kind of videos do you want about relationships, and I'll explain more later in the video. So going back to the definition of narcissism, someone who's selfish, lack of appreciation would be a very clear sign in his character, thinks about himself, and uses people as objects towards his needs. That's basically a narcissist in simpler terms. And the empath is the exact opposite. The difference between the word covert narcissist and overt narcissist is that those signs will be clear with the overt narcissist. He will show it to you in real life. You will see it clearly. He will be toxic and proud about it. But the covert narcissist, he will keep manipulating and showing an image of a charmer, someone who is showing the exact opposite of who he is. That's why in realistic analysis, I always urge my clients to just create a sheet of paper and they try to cut it into half. Half of it they write down the actions of the other person, and on the other side they write the image that he was trying to portray. The image is usually portrayed through words. So the things that he used to say about himself and the things that actually happened, to differentiate between the image and the real person. Actions, they speak louder than words. This is a simple exercise. If you keep doing it while going through your relationship and reviewing everything that you went through with the other person, you will start differentiating between the image and the actions, the real person and the image. You might have been with someone who is a victim, who is suffering from victimhood, and the victim complex took over his character. So he always wants saving. And because of your boundaries with that person, he left you. And once you realize that, you'll be able to differentiate whether this someone is worth mourning and grieving about or not. The same goes if you were with a beauty who has somatic narcissism, who always looks for a better person. She might have found someone who is better than you, whether in social class or financially, or he was well off, generally speaking. And she chose to be with that someone because of how he looks or because of his social status. And she gave you some excuse about the reason of leaving you. Somatic narcissism might happen in women and men, so everything I'm gonna say, it works both ways. What I do with my clients and what I urge you to do after watching this video is writing down most scenarios and situations that happened between you and your ex, and start finding the reflections of each scenario. What does each scenario reflect? What does it say about you and what does it say about the opposite person? By that you will start understanding who are you and what are your patterns. For example, if you found yourself submissive in multiple situations and you realized that you were not speaking exactly how you feel, just trying to mold yourself to please the other person. In this situation, write that I have people-pleasing behaviors, or I'm a nice person but in a passive way, what I call passive niceness, or what Dr. Robert Glover called nice guy syndrome. Whether it's nice guy or nice girl, it's the same idea. If you are passively nice, this is a very negative pattern. You will keep molding yourself to the needs of the other, ignoring your own needs. In other situations, you might find yourself over-giving, over-fixing, so this is another sign. Certain situations, you might find yourself putting or establishing certain boundaries, and this is a good thing. So when you analyze, or when we analyze the situations, you will understand more clearly what went wrong, what are your strengths, and what are your weaknesses. And you'll have a balanced view of what actually happened. Reviewing love actions is an essential step to analyze properly. But a lot of clients I've met before, they kept asking me, doctor, what do you mean by love actions? I'll create a video about love actions if you are interested, but to simplify, or let's give you some situations where love actions are actually met. For example, emotionally, if this person is intimate with you, holds on to you, available to you, cares about you, tries to monitor your day the same way he is monitoring his. He follows up with you in every single thing that happens with you. He genuinely shows the care in multiple occasions. This is emotional. Financial, if he's supportive, if he doesn't think about money when it comes to you, if he gives you the feeling that you can depend on him in that aspect, and I mean by depend, a healthy way of dependency. Socially, if he has your back. Sexually, if he has proper conversations with you after the sex, before the sex, cares about your needs inside the sexual process. All of these are signs that you should be taken into account when analyzing love actions. Because, a lot of patients, when they told me, doctor, but the other person, I know he loved me. When I asked him, how do you know? He said, he usually says that I love you, but he wasn't available. He didn't put enough effort. Love actions weren't there. When you needed him, he wasn't available. Sexually, he wasn't caring. financially. He was giving you the feeling that you cannot depend on him. So all of these signs, accumulative, are giving you a negative signal about love. So whatever you called love was actually wrong. He didn't respect your boundaries, for example. When you were around him, you were always trying to prove yourself somehow, or pushing yourself hard. When you talk, you try to explain yourself. You don't feel accepted. Every time there is a problem or a quarrel or a conflict between you two, he doesn't allow you to talk about it, to express your emotions, to express how you feel. Even when there is an issue, he might give you silent treatment. So these are just signs that gives you a depth of the relationship that you used to think or that you used to perceive is totally different than reality. They keep insisting. Intense absorption of reality is my method. This is why I called my method the realistic psychoanalytic approach, because I don't agree with the regular stereotypical psychological methods that are being used nowadays. I don't see them as realistic as what I do in my clinic. By realistic, I mean I connect to the person's story without using a method in my mind, as much as I try to analyze what happened to him, and we go through the actions together. We try to see and delineate what are the mistakes or the faults that he went through, and the same goes for the other party. During the analytic endeavor, we'll go through the healthy and unhealthy patterns of attractions. And this is something a lot of people don't know anything about. Someone who has the submission complex, who fears confrontation, who always submits when it comes to emotions and does what the other person wants, and doesn't know that he has this complex, he will keep repeating patterns of being with people that are controlling. They try to control him, they try to push him around, they try to make him do whatever they want. Someone who has a submission complex, and by submission complex I mean he's always submitting emotionally, he does what the other person wants, he fears confrontation, he exaggerates the consequences of any confrontation, he plays the nice person always, will find himself always in patterns with people who are controlling, who are rude, who will try to take over him, push him around. And he doesn't realize that this is a pattern of attraction, that because he has this issue, and most likely it's related to his childhood traumas and how his upbringing was, it does create conflict that he keeps repeating the same patterns with the same people without realizing whatever is happening and why is it happening this way. So when I explained to him, okay, because you have the submission complex, the attraction that you have is unhealthy because you don't have real compatibility with the other person. What you have is just a feeling of attraction that is stemming from a complex. And when I say this, usually people, they get impressed by the idea itself. Is this chemical feeling that we have, this chemistry that we have with someone, might be an unhealthy form of attraction? And usually it is, especially if the other person that you're with is incompatible with you when it comes to logic or when it comes to real life. You find yourself a mature person who worked on himself, who's an entrepreneur, who wants to achieve something for himself, who is sticking to a schedule, is maintaining his gym and routine, and you choose someone who is far behind you, who's toxic, who's dramatic, who is much less conscious than you, and you are actually attracted to him or to her. From where this attraction is stemming? Why aren't you analyzing their behaviors from a three-dimensional perspective? Because usually people who are immature emotionally or who didn't go through enough experiences when it comes to relationships, they usually have one-sided or one-dimensional form of analysis. For example, you were with a girl and she tried to push you around by saying something about how you look, and you put a boundary and created a boundary and you told her, I didn't like the way you talked. You might analyze it from a one-dimensional perspective that she was rude in this situation. But if you looked from a second dimension, you might see her also rude with multiple other people. You might find that this rudeness is a reflection of something deep within her. Maybe she has this fake prowess. She wants to show that she is powerful or controlling because of some issue in her childhood. So this is a second dimensional look. You looked at her behavior from a bit larger perspective. If you looked from a three-dimensional perspective, you might see that this person is actually a narcissist. This person likes to control people. What she did with you, this rudeness, wasn't just out of coincidence, and nothing is out of coincidence. Those slips, they give you signs about who people are. If you look at it from a one-dimensional perspective, you will just look at the behavior as a behavior. From a second-dimensional perspective, you will just see it as a reflection of something superficial inside the person. But mature people, they see from a three-dimensional perspective. And this is something I teach people. Robert Greene once said, people never do the same thing once. And by that he meant that it reflects something deeper hidden within them. In analysis, I see it 1, 2, and 3 dimensions. I created a video about healthy and unhealthy attractions, and to differentiate those patterns between each other, you can see the link down and go to that video and watch it. It will be helpful in making you understand attraction from a holistic perspective. A question might arise here. You might ask me who to do this realistic analysis with. Is it with myself or a friend or an expert? First, let's start by the ideal way to go. Ideally, it is with an expert or a therapist, but you have to understand that not all therapists are the same. It's not about the methods they're using, it's about their life experience, the content they create, their mindset, how they perceive reality. This is the key. When I choose an expert, I don't look much at the certification or academic degree, because you might sit with experts who have very high academic degrees in this field, but when it comes to real life practice, real life experience, it's negligible, it's second to none. You might sit with people who are the best clinical psychologists or psychiatrists, and you find them not experienced enough when it comes to this process. They don't have enough life experiences, they don't have introspection on their subjective experiences. So when you sit with them, you will see that there is a huge gap between what you're talking about and whatever they're saying. They cannot connect to your emotions at a deeper level. They cannot understand you. They cannot see through whatever you're going through. And they cannot analyze properly even. They keep just validating your emotions. And even though emotional validation is important as a part of therapy, but when I used to go to therapy as a youngster, I didn't think about validation first. I thought first about the analysis, about what happened, about why I did what I did. Why did this breakup happen? What did I do wrong? What are the actual mistakes that I did, not the hypothetical, not the things that I think that were wrong? And this is what benefited me the most. So the first step, choose someone who is an expert, who has been through life experiences when it comes to this process or this problem, who has dealt with a lot of patients or clients who had gone through this process, so they can guide you through the process or through the experience properly. My best way to go is to look at their content, watch their videos, read their books first, before even taking a one-to-one session with them. If you listen to their videos, watch their content, you realize that they know what they're talking about, they have an overarching perspective of the topic. Then after that, you have to decide on whether to talk to them one-to-one or not. And if you do decide that, you have to at least go for 12 sessions the least, so that you can build momentum with the person, feel accepted, feel validated, and at the same time be able to believe in whatever he says regarding his analysis of the story. In case you have a problem financially or this person is not accessible through consultations or sessions, you can watch his content and try to relate it to your experience with the best effort you can. For example, when I was young, I read Dr. Robert Glover's book, No More Mr. Nice Guy, and it was about the idea of the nice guy syndrome, of passive niceness, or being people pleaser. I liked the book, I liked the content, I liked the idea. I was able to relate it to my experiences easily. I wish that I had the chance to talk to him back then, but he wasn't accessible, or I think financially I wasn't well off. So I did the whole process by myself. I know that it is more difficult, it takes more effort, it might have a lot of flaws inside of it, because when I read something for someone else, I might read it through my subjective lenses and subjective personal experience. And this might create a bias, because the personal experience of myself was much less than him. So what I see as mistakes, maybe I'm not seeing the whole or the big picture of the faults that I've been through during my relationship. A friend with experiences, he might be helpful. He might see some stuff that you are not able to see. But the problem with the friend that he measures and sees through purely his subjective experience. While the expert, he might see through a whole lot of hundreds or thousands of experiences of people who he helped. So this is a huge difference. That's why what an expert therapist sees might be totally different from what your friend sees. Maybe your friend has been through 3, 4, 5 relationships or breakups, and he might be able to help you through it with whatever means he used back then. But still, his analysis might be hugely lacking. But when it comes to the therapist, that would be totally different. I like analysis because analysis gives me a strategy, gives me a perspective on my mistakes and I can basically understand my patterns. That's why I prefer analysis over other modalities of therapy. But generally speaking, as I mentioned before, it's the expertise of the person that truly matters. Because when I had a breakup, I didn't want a pat on the back. I didn't want emotional validation. I wanted someone who gives me constructive feedback, who gives me a strategy of understanding myself, understanding my mind and how it operates in my reality, and how to get over those patterns and break them off. I wanted something solid, realistic, that is actionable, that I can work on practically immediately. Not something that is just words of validation and a pat on the back. Not some sort of he doesn't deserve you or she doesn't deserve you. I didn't want those words. I don't care that if the other person deserved me or not. I care about myself now and healing properly and not repeating the same mistakes. Because usually in the realm of relationships, most people I've met in the clinic, they kept repeating the same patterns over and over and over. Hence, I called my first best-selling book, Your Psychological Complexes Are Gonna Be Your Eternal Prison. I said that because those complexes, they keep repeating themselves in a story after another. If you didn't learn the lesson, if you didn't understand the pattern, if you didn't try to fight it in reality and understand the stem from where it came. For example, when I talked about the guy who had submission complex, he had it because his father was abusive. His father used to hit him over trivialities. So he started fearing confrontation. He started having this coping mechanism of staying silent whenever he gets confronted by anything, because he's exaggerating the consequences. He thinks that this will happen again and again, but in a different way. So his fight and flight response, the sympathetic overdrive, happens whenever he gets into a confrontation. That's why he gets pushed over by his friends, his girlfriend, his family members, without him realizing why is this happening, without him understanding why isn't he able to create or establish boundaries, even though he read a lot about boundaries, but he's not able to apply it in real life. I wanted to clarify that a friend might be actually very helpful in this period. Talking about what you went through by itself is helpful. And in the section of emotional release and expression, I'll elaborate more on this point. But it wouldn't be the cure. It's just pain numbing. It helps in releasing some emotions. It helps in making you feel better. But it's not the actual treatment. It's not the strategy to go through to heal yourself. So there is a huge difference. I don't want you to misunderstand what I'm saying. You might need real friends, supportive friends in this period, even support groups, people who went through the same process or the same problem, and they start sharing whatever they're doing to help themselves right now, or sharing their pain. Because some friends might feel burdened by the fact that you keep repeating the story and talking about it and talking about what happened. The expert might help you understand. When you talk about something, he will make you understand each and every single scenario and correct your way of thinking and the frame that you saw the stories and the lenses that you saw through. The trap of trying to do it 100% yourself. This trap is when we try to heal ourselves by ourselves, the first problem that we encounter is that we analyze through our subjective lenses, through our previous experiences. So if you have just one or two experiences in a breakup, your vision would be hugely lacking. You wouldn't see from a larger perspective. And this is a big problem. You might think that you did a lot of things wrong, but they weren't wrong, and you might think that you did the other stuff right. For example, you might think that the love bombing that happened in the first or the start of the relationship was a good thing, that she was actually loving you, without realizing that this was some sort of reflection of an inner emptiness inside her. And because of lack of experiences, you kept analyzing in a wrong way. This is the first trap. You might think that writing is as effective as talking about what happened, but it's nowhere near that. We humans are emotional social creatures. Talking about our issues is the key to release the emotions and start the healing process and reconstruct our mental model and thoughts. I can read 100 books about iron deficiency anemia. In real life practice, if I didn't see any case before, my actual experience would be is that I don't know how to deal with this patient because I just read about it. I didn't see it in real life. And even when I practice trying to heal this problem or trying to heal the problem of iron deficiency, I will need someone to evaluate the way I introduce the therapy or I introduce the treatment. So evaluation of the experience is key to maturity, and the more evaluated experiences you have, the more mature you'll become. So when it comes to the trap of analyzing the whole thing by yourself, is that you don't have someone who is evaluating from different lenses. So you'll keep just evaluating it yourself, and because of the fact that you're lacking in previous experiences, you won't be able to understand what actually happened. You can learn to box by yourself, or you can learn to box by a mentor who's been through 1,000 match. Which one you think is better? The same goes for healing. You might think that it's different, but it's exactly the same. When you sit with someone who's an expert who saw thousands of clients in front of him going through the process, it's easy for him to pick through the traps that you are going through in the healing process, and will he'll immediately back you up and tell you that, oh, you're going through this trap or that trap, oh, now you're thinking about this, which is a faulty way of thinking, oh, now this complex got activated, and you're just exaggerating and romanticizing the relationship instead of focusing on the actual negatives that happened and how the other person treated you. So this is a huge difference. In psychology, I think a lot of you heard about the grieving process and the stages. The stages, they might happen concurrently, and they are not necessarily in order. The stages are denial, bargaining, anger, depression, and acceptance. When it comes to realistic analysis, once you analyze the story and understand what actually happened, understand your weaknesses and strengths, you can see the other person from a larger perspective. Now you'll be able to cut through the how and why of the denial stage. Because in the first stage, usually the denial, when you deny what happened and you keep asking yourself why and how and what went wrong and what did I do wrong and why did we end up this way, the analysis will give you the answers. So it will cut through the stage, and it's also going to cut through the fake hopes of the bargaining stage. In the bargaining stage, you will feel like you keep having hopes of what if the other person comes back, what if he might contact me again, maybe he is rethinking this whole thing. So this bargaining stage wouldn't help you to accept the fact that he went away and he went in his own way and he let go of you. So once you analyze the story properly, you will stop bargaining, you'll stop re-questioning how and when he will come back, and you'll be able to move to the anger stage and express your emotions so that you go through the bargaining stage. Helps you in having realistic hopes, not fake hopes. Fake hopes, when you sit and just wallow on what happened and think that they might change their opinion and come back to you without anything that you are able to control. The bargaining stage helps you in cutting through any type of fake hopes. It makes you realistic and know exactly how to go through the other stages of your life. After a proper realistic analysis, now you'll be able to make a very solid decision not to go back to this person, to move through the ladder of the grieving process, to either cut contact completely with him or try to hold on to the person. If you found in the realistic analysis process, if you found that you have been mistaken in a lot of scenarios and there is a chance to go back, it's not a mistake to go back and try to hold on to the person and show him that you are wanting to change and you want to actually work on yourself and you realize the patterns that you have defect or issues with and you want to fix them. This is not wrong. Actually, we are in a world where everyone abandons easily, and it's very difficult to find someone who holds on to you. So if you are someone who realized that he did a lot of mistakes in the relationship and the other person deserves an apology or deserves holding on to, you have to do that. Don't just ignore the step and be like, okay, it's fine and I'll just move on and I'll do it right when the other person comes or when the new person comes. Once anyone reaches a solid decision to move forward, accept the fact that the other person has been already dead to him, the depression phase usually starts. In the depression phase, it will look exactly like clinical depression or the so-called clinical depression in the DSM. What is clinical depression and how does it look in real life? To be honest with you, I'm with the anti-psychiatry movements in a lot of things. One of them is that calling depression a disease or a disorder, that by itself is something I don't agree upon. Depression is more of a coping mechanism, more of a response, more of a reaction to the breakup that you went through. They might call it a grieving process, or sometimes if the grief continues for a longer time, they might call it depression. This is in psychiatric terms, but I don't want to confuse you with those terms. I just want you to understand that the grieving phase will look exactly like depression when it comes to symptoms and signs. And in psychiatry, they might call it actually clinical depression if it lasted for a longer period of time and it affected your life significantly. But just be mindful of the fact that depression is not a disorder by itself. The word disorder comes from the fact that it affects your daily function and it hinders your daily life when it comes to your work or relationships. That's why they call it disorder. But it's not a genetic disease, or it's not something that you need drugs to heal. Even the antidepressants that are being marketed nowadays as the cure for depression or the proper treatment for depression, they rebalance the chemicals in the brain. This is all not based on solid evidence. This is all marketing. There is no actual theory that says that depression creates a biochemical imbalance. Those drugs by themselves, they go to the brain and they have a psychotropic effect. They have their own effect. That's why they affect the brain in a way that makes you feel different. It's more of a drug-induced effect. If I give someone alcohol and he has social anxiety, he'll feel better. That does not mean that alcohol is fixing some sort of imbalance in the brain. The same goes for cocaine. If I give cocaine to someone who's depressed, he might feel much better, but that doesn't mean that it's healing the actual issue. Depression, in those cases, it's more of a response to the breakup and to the emotional attachment that you're having with the person. It's very difficult. Breakups are extremely difficult. Even when I talk to clients on a daily basis, I can see the frustration that breakups create. Even in my history, in my past, when I had a breakup multiple times, it was extremely devastating because I'm more of an empathic person who usually has an anxious attachment problem. So it used to take a huge toll on me because my form of love wasn't actually healthy. I was more leaning towards love addiction, is to have the person become the center of my life. Everything revolves around him. If he talks to me, I feel much better. If she doesn't talk to me, I'll feel much worse. So whenever I was with any girl, I used to be attached extremely in a way that makes me vulnerable, but not in a healthy way. And this is the difference between attachment and love. In attachment, because of the complexes that are involved in the process, you might lose yourself. But in healthy love, you will always maintain some sort of self-sufficiency. Let's go back to depression. So if you found out that you are depressed in this phase, you cannot depend on medications to heal yourself. And I want you to make medications the last resort. If you weren't able to get out of your bed to actually do any of the stuff that we recommend to help you to overcome the breakup. If you couldn't do that, if you couldn't behaviorally, mentally, emotionally work on yourself, unless there is a medication that boosts the system, I would be fine by that. But I would urge everyone seeing this video to make antidepressants or any sort of psychotropic medication the last resort. Nowadays, psychiatrists, even family physicians, are easily prescribing those medications as if they're totally safe. And this is what I call the safety bias. They think that they're safe, but the actual data proves otherwise, and we don't have long-term studies upon those medications. But what are the signs and symptoms of depression? What am I talking about? First, the sleep. You have sleeping problems, you might not be able to sleep properly, and you have to fight back when it comes to that. You have to not oversleep. Try to fix yourself to a certain routine when it comes to sleeping patterns. As much as possible, you wouldn't be able to make it in an ideal way. Also, I wouldn't recommend taking sleeping aids because you might depend on them. Even if you didn't depend on them biologically, psychologically, this might happen easily. You might lose the interest in the things that you used to love doing, what we call anhedonia. You might lose it and you might feel like totally disinterested in everything. And it's fine. The more you do the stuff that you like, the more likely the emotions and the feelings involved with it will come back to you. But you will have to wait, you'll have to give it time, you'll have to practice doing the stuff even though you are feeling nothing. And this is what we call discipline. If you try to discipline yourself even 50% in this period, it will help a lot in overcoming the problem of interest. The third sign is guilt. You might feel guilty because of what happened, especially if you found out after the realistic analysis that you made a whole lot of mistakes. You had been extremely nice, or you had been abusive, or you had been manipulative. Once you realize those things, you might start hating yourself. Or if you realize that you were a child, that all of your behaviors were immature, and you weren't introduced to those topics of self-development and understanding unless after the breakup happened, then you might hate on yourself, you might guilt yourself, you might feel like you lost a very precious person. And I can't deny that losing a precious person or a real person might take a toll on anyone. And even if you ask me myself, if you ask me, what do you regret, doctor, in your life? I would always say, maybe everything that happened actually molded me towards who I am, but the one thing that I keep regretting are the people, the real people that were in my life, and I wasn't able to invest in them properly. So, feeling guilty to a certain extent might be plausible, but I don't want you to exaggerate the guilt. I want you to treat yourself with self-compassion, as if you're dealing with a child. Imagine that you are your own child, and you're talking to yourself right now. Be nice on yourself, be empathic, be understanding. Because of the depression, your energy levels, your concentration might be down, which is fine. You have to keep trying to discipline yourself to the routine, and I'll explain other things to do later on in this video, and those will help you get over the energy and concentration issues. Appetite might be severely hindered and affected. You might overeat or undereat. Be careful from overeating, because this might create a vicious cycle of gaining weight and hating on yourself more. Undereating sometimes might also create issues, so you have to have a balanced form of nutrition and diet. Low to moderate carb intake. Protein intake has to be maintained properly. And in this period, I keep telling my patients, go train. Whether you train in some sort of martial art or you're training weights to maintain muscles and have a better shape, it's always a positive thing. If the depression took a toll on you and you couldn't handle it yourself, you have to see a professional as soon as possible. You might need the medication, even though I hate medications as a concept, because I see them as some sort of medicalizing of the human experience, but still, in some cases, we might need to give them. By now, I finished the first stage, major stage in healing or overcoming a breakup. The stage was realistic analysis. Try to analyze realistically what actually happened, understand the strengths and weaknesses of yourself, of the other person, understand your attraction pattern, review the love actions, cut through the phases of grief, whether it's the denial phase, where you'll understand what actually happened, the bargaining phase, where you'll not have more fake hopes about the other person returning or coming back, or his form of reason of why he left, and you'll understand the actual reason. And then you'll move to the depression phase, where you might feel depressed, especially after you take a decision cutting this person off and leaving for good. And the depression phase has to be countered by doing everything possible without a medication before resorting or before taking the medication as a last resort. I hope by now it's clear to you how the first phase should go. And I hope that you realize that you don't have to depend on an expert or a therapist if you can't afford it financially. A lot of experts in YouTube, they offer solid advice when it comes to overcoming a breakup. Some of the trusted experts, I mentioned the name Dr. Robert Glover, Teal Swan. You might also watch videos for Dr. Jordan Peterson, Robert Greene. There are a lot of people who talked or tackled this issue from multiple angles. It's not for me to recommend who to watch. I want you to go and watch material and find whoever resonates with your soul and with your personal experience and who understands whatever you've been through. Don't be cheap on the part of therapy or meeting with the expert one-on-one. If you meet with an expert one-on-one, he might customize this whole content to your personal experience, and it makes a huge difference. So if you have the money, if you have enough finances to go to this special expert, don't think twice. The second phase of overcoming a breakup is emotional expression and release. What do I mean by that? A breakup is a form of trauma, and it will take a huge toll on your system. And we are emotional creatures, so the emotions that are involved in the process might be stuck, and they might need reprocessing. By reprocessing, I mean you have to relive the experience, talk about every single detail, how it happened, when it happened, and reliving, I mean in depth and details. It's not just summarizing logically what happened. And this is a big mistake. A lot of patients I encountered did it in front of me, and I kept telling them, I don't want the logical summary of what happened. I'm not asking you for a review or a summary of your story. I'm asking you of what actually happened in depth. So instead of telling me, okay, she was abusive and she was someone who didn't try to cater for my needs or didn't try to fulfill me sexually. Talk about the experience. Okay, when it comes to sex, the first scenario that happened, one time she came to my room and she told me that she is totally disinterested in me and she doesn't like the way I behave in sex, and she didn't clarify even why. You see that when you explain the situation in that tonality and you actually express your emotions, you say that I felt abandoned, I felt ashamed of myself, I felt inferior to her, that's why I lashed out and we had a huge fight, and then after that I broke up with her because I couldn't bear living with the fact that someone dislikes me sexually and want me to continue with him. You see, if you tell it from a realistic perspective and emotionally expressive way, it will be totally different and it would sound different to the analyst. Because in analysis, a lot of people ask me, how can you judge a story without listening to the other party? If, like, for example, the other person didn't come to me. I don't judge. I just look at the actions through the context of a scenario. So unless the person is lying about the scenario wouldn't lie. I don't look at the descriptive way the person is talking about the scenario. For example, if he told me she is abusive sexually, this is a statement, a descriptive statement. He is describing what he thinks, but this might be not the truth. He might lack in his area of sexuality, he might be lacking in hygiene, he might have issues with erectile dysfunction, he might have issues with insecurities in himself. So she felt burdened by all of those issues and he wouldn't be able to, or he wasn't flexible enough to talk about it. He was insecure about that. So she lashed out. So the actual thing that happened was his mistake, not her mistake. But when he describes it, it might sound as if she did something wrong. So I wouldn't listen to a descriptive statement, I would listen to the actual scenarios. And this is the key to analysis. Even when you do it with yourself, as I mentioned in the first stage, you have to write down the actual scenarios without biasing them through your descriptions. But when you explain or express your emotions, you have to express, I felt, and you have to talk about how you felt in this experience that you relived with me. A lot of conscious people or mature people, they might fall into this rationalization trap. They rationalize through the story without talking about their emotions, and they think by that they're well off. They'll be able to get over the other person or the breakup. But this is not reality. Reality, we are emotional creatures. We need to express. Even though, I'm a guy, and in my culture, it was difficult for me to express when it comes to talking about a breakup. And it felt very shameful to actually start expressing. But nothing I did actually healed me as much as explaining or expressing my emotions as they are, without trying to cover them or filter them or saying them in an ideal way. So I have to just state whatever I feel immediately as it is. I want to stress a point that in trauma reprocessing, most psychological therapies are formulated on the foundation of trauma reprocessing or reliving the experiences and expressing how you feel. This whole thing, without analyzing what happened, wouldn't be that helpful, because you might express your emotions, but at the same time you are feeling guilty about something that you didn't do wrong. You see the importance of analysis. I keep insisting on its importance. That's why you have to read realistic books on how to analyze what happened between you two and how to see through the patterns. The second thing, since most psychological therapies are based upon this idea of trauma reprocessing or reliving the experiences and expressing and releasing your emotions, you have to realize that it is a step that you cannot go without. We humans express emotions in words. Since we were born, as children, we go to our parents and talk about what happened in school and talk about our emotions. A lot of children, when they start realizing that their families are not giving them enough attention, are not listening to what they're saying, they start shutting themselves off, and they just think that they can rationalize through the problem and heal whatever they've been through, which is wrong, because this will create some sort of a complex. It's more of a fake sort of toughness. They will think that they're tough because they're not sharing or they're not being vulnerable, but this is a huge trap. The problem is that I noticed that a lot of patients in my clinic, they do the same exact thing. They don't want to be vulnerable enough. They keep talking as if it's just something that happened and they got over it. But while they're talking, you feel the intensity in their emotions. You feel sometimes a tear dropping. You can see it but they keep denying and they keep rationalizing because they're conscious enough what happened and conscious enough of the analysis, and they know why it happened this way. But knowing is not enough. You have to release whatever emotions are stuck, and you have to release them by words. You have to talk to someone. You have to say them out loud. Writing them is totally not enough. I tried this method of writing myself and with my clients. I didn't see it like even half as effective as talking about it. And even those psychological therapies that you just, like hypnotherapy or other form of therapies where you just meditate on the feeling and let it go, I don't truly believe that works 100%. It might work to a certain extent. It might work with you. I'm not sure. You have to connect your emotions and to your personal experience. But what I see in the clinic is that people, when they speak their emotions out loud, this is the ultimate best way to go. If they couldn't say it to a therapist or they couldn't afford a therapist, they can do it with a friend while maintaining and telling the friend that they don't need any sort of feedback. Because, feedback, if it's not constructive, if it's not based on a whole lot of experiences, it might be against you. The person might be biased towards or against you. So be careful. Regarding emotions, I always give my patients the metaphor of the cannon. Imagine that emotions are like balls inside a cannon, and we humans are emotional creatures. Since we are kids, we have to express our emotions authentically to become our true authentic selves. Our parents, they have to help us in this expressive process. So those cannonballs, with proper maintenance from the parents, they will go out immediately according to the situation. So when we feel angry, we'll express anger. We'll feel frustration, we'll express it. When we feel that we want to cry, we'll cry. When we feel we want to confront, we'll do that. So every emotion is getting outside or leaving the cannon in a healthy, proper way. But in dysfunctional childhoods, where children are not allowed to express themselves properly, those cannonballs might be suppressed one over another, and they might block the cannonball, so our emotions becomes filtered, we cannot express properly, we lose touch with how we feel, and if they get accumulated, we might sometimes explode all of a sudden or implode on the inside, where this cannon eats itself and medical or psychiatric disorders start to form inside us. So emotional suppression, I see it as the father of most medical and psychiatric issues. You have to be very careful from suppressing your emotions. It might actually kill you, eventually, chronically, over the long run. So when you express emotions, you have to express your anger, your pain, your frustrations, your fears, and you have to say them without feeling judged or fearing being judged, and you have to express them out loud, and it has to be with someone that gives you acceptance over those emotions. You don't have to rationalize a lot through those emotions. You don't have to think about what you're going to say. If you want to say this person does not deserve me, I wish that I didn't give her what I did before, I wish I didn't cater for her needs, I wish I didn't allow her to push me over, I wish that she never finds happiness. Even though those words are not healthy 100%, you wouldn't want to wish on anyone that he lives without happiness, but those are your emotions in the current moment. So just express them without judging them so that you get over the stage. A helpful method here in expression: list all the negatives or the negative scenarios, the actions that actually hurted you from this person throughout the relationship, and focus on talking about those actions, those negatives. Because the brain has a bias in this period where it romanticizes the positives of the person and shows you the pluses of what you lost. And this might be very counterintuitive, and it wouldn't be helpful at all. A lot of patients told me, but doctor, this way I'm being ungrateful. I'm just focusing on the other person's negatives, but this is not the whole story. He was a good person. He did a lot of good deeds. I know that. But it's not the time to remember this, because you want to get over him. I don't want to create an enemy out of him, but to get over him in this phase, you cannot focus on his positives. This might help in expressing whatever emotional suppression you might be having in this phase. With regards to suppressing emotions, I mentioned that it might be the start of medical and psychiatric issues, because it might lead to chronic stress inside of your system, and this chronic stress might actually be very damaging over the long run. You might not see it immediately. You can read Dr. Gabonati, his work on this topic specifically, enlightened me a lot, and it actually resonated with me and with the patients that I see on a daily basis. A lot of patients came to me to treat rheumatoid arthritis, or to treat migraine, or to deal with MS, or to deal with IBS, and the original problem was an emotional suppression that was created because of a lot of negative patterns in this person's life. A pattern of over-responsibility. The person takes the burden of responsibility in an extreme way. He just feels responsible for how others feel. He just feels obligated and guilty if he didn't do what others want, and he neglects his needs. Or someone who has a pattern of the fake toughness. He doesn't show vulnerability, so he suppresses all of his emotions, and this damages him neurologically, digestive system, hormonally. So there are a lot of damages that might happen because of emotional suppression. This topic specifically, I wasn't fully aware of the damaging consequences of the suppression till I saw a lot of patients, and I wrote about it in my book. And at the same time, when I saw the work of Dr. Gabor Mate, I realized that it's not only me who saw this. Other doctors also realized that something like that existed. Unfortunately, in medicine, they don't focus a lot on the idea of emotional suppression. That's why they still have the word idiopathic on many disorders. They don't know the reason behind them. Suppressing emotions might make you reactive. You will see yourself always reactive. You are not fully in control of your emotions. You might lash out over trivialities. You might cry over just any movie you watch. You wouldn't understand why is this happening, this hypersensitivity that is taking over you. But it's all because of it. You might project those emotions on someone who's not guilty, who didn't do anything. You might fight with your brother or fight with your friend over something that he didn't do wrong, but you can't control your emotions in this phase. The reason behind this is you are suppressing. You don't know that you are creating a larger problem by suppressing. Aside from that, suppressing emotions might create new psychological complexes, like the complex of closeness. You won't be able to get close or intimate with new people because you are afraid now of intimacy, and those emotions are suppressed, and the fears involved within them, they create this complex. Or you might create a complex of trust, where you cannot trust people anymore and you have trust issues. Suppressing those emotions and not having someone speak to your mind and touches your soul and understand you in this phase and make you reframe what happened in a positive lens will be a very damaging experience. Hence, I tell many patients, thinking that you got over the breakup is not the same as making peace with this breakup or with this trauma and what happened with it. Getting over something, it means that you jumped over it without going through this problem, and it stayed there somehow. The trauma is still stuck inside you, but going through it and making peace with it, it means that you are unentangling whatever happened and understanding why it happened and expressing your emotions through it and going through the process. Our aim in psychoanalysis is to make peace with whatever you've been through. Making peace with it is the key. The analytic endeavor is like a surgical resection. It will be very painful acutely. The pain might reach up to 7, 8, 9 because you're speaking about things that you don't want to speak about. You are recounting events and seeing yourself from a larger perspective and noticing your mistakes, your misdeeds, your mishaps. But at the same time, this acute pain is actually freeing. You'll be more conscious. You'll have more tools to use in the upcoming relationship. You'll be more self-sufficient. But if you ignore it and suppress emotions and try to get over it instead of making peace with it, you'll have a chronic pain, 3 to 4 out of 10. But it remains inside you and eats inside your guts forever till you actually heal it. Because if you didn't understand the patterns and if you didn't express the emotions, the complexes might harm you in the next relationship. So you cannot run away from it. I met a lot of patients who after a breakup stayed stuck in the breakup phase or in the healing process. They didn't heal properly for years. I met a lot of clients who stayed 3, 4, 5 years thinking about the person till now. And the reason behind that, they didn't know how to go through this process and they tried to jump over it or get over it without making peace with it. During the emotional expressive phase, you have to realize that even though you're expressing all of your emotions and your anger, some things that the expert might say might not resonate with you because he's analyzing from a broader form of experiences. So he's seeing things that you cannot see properly. And once that happens, you don't need to overindulge in analysis and go into the analysis paralysis mode. You just need to understand that some stuff might not be clear 100% till you go through experiences, which is fine. And don't overindulge in analysis. Just do it once, do the basic infrastructure, understand the major mistakes, and that's it. You wouldn't be able to understand everything. After the second, third, fourth experience, your eyes will see much clearer and things will be easier to digest back then. A lot of patients ask me in this phase, Doctor, shall we go and confront the person with how we feel? This is very relative depending upon the case. If you were the one who was mistaken and it ended and the person doesn't want to build the relationship again with you, you can go and express your emotions from an apologetic attitude. But if someone was a narcissist who actually mistreated you, who tried to manipulate you, you might go and express how you felt without letting them talk, because once they start talking they might gaslight you and blame shift and switch the whole thing against you. So you have to be very careful in the confronting, and you have to ask the expert that you're with to know whether to confront or not, whether it's a proper time, proper words, the attitude, the whole of it. Now I'll move to the behavioral traps that happens during the first and second stage of overcoming a breakup. Now you analyze the story, and at the same time you are expressing your emotions and releasing whatever is left inside. But those traps you might encounter and you might not be able to deal with them, and those traps usually what get people stuck into relapses, into their depression or grief with regards to the breakup. So let's start with the first trap. The first trap is stalking the other person in social media or looking at the WhatsApp status and stuff of that sort. What I mean by that is that when you start stalking the other person, you might think that this is just of curiosity, because a lot of clients, they told me, Doctor, this is out of curiosity. This is just to understand and see if he's also suffering like me, if he ditched me for someone else and I'm looking in his account, who is he following? All of this is just wasting your time and making you stuck in the process of overcoming this breakup. You will just keep thinking about the other person instead of thinking about yourself and how to get over it. He might be a narcissist who wants you to stay there like a standby to him, and he wants to come back to you whenever he wants. What we call intermittent reinforcement. He might come back to just ask about you and see how are things with you, not because he's missing you as much as he wants to confirm and affirm that your emotions are still there for him. And a lot of narcissists, they do that. They want you to stay there while they keep living their lives and meeting new people. They want to make sure that you're still having emotions for them. This is not in a direct way, it's more of an indirect way. It's not clear, they don't say it out loud. And narcissists, they never say it directly in front of your face. So during this phase, if you keep monitoring, they might hint at you in their social medias. They might say something in Twitter that actually touches you, or they might put a song that means they are missing you, and you might start having an illusion and thinking that they are thinking about you, and this will distract you completely from the process of healing. You wouldn't be able to heal if you kept doing that. So monitoring the other person's social media is a big no. And if you couldn't, some people, they get addicted to this process. So I tell them usually, just keep a watch beside you, give yourself 10 minutes of monitoring, write your feelings before, why are you doing this, and write your feelings after. Behaviorally, this is a method that I use sometimes, and it actually helps because whenever they monitor and stalk, they have a timer and they have emotions written and thoughts written in front of them that makes them understand that whatever they're doing is actually hindering their growth and hindering their healing journey. Because once you, like, even if a lot of patients, they felt better a lot after a while, but once they stalk, they start noticing stuff that takes them 3 steps backwards, and they get depressed and they stop doing whatever they were doing. They stop their grounding system or their discipline or their exercise or their readings, and they just want to stay in bed. So this is very dangerous. I kept repeating and insisting on the risk that you're taking if you kept stalking the person. The second trap is not eliminating all the triggers. You have to eliminate all the triggers, and by that I mean images, photos, previous conversations. If he's not blocked in one of the social media accounts, you have to act as if the person is dead. It's not the right time to befriend someone whom you're trying to get over. After you heal and after you move on with your life and you might meet someone else, later on, if you go through the same expert that he's with you and he gives you the permission that if you want to talk to the ex as if you are just friends, I'm fine by that. But I wouldn't recommend it unless you became really mature and you got over it 100% It's highly unlikely in the first year, so I wouldn't go near that. Third trap is staying in bed. Bed is very extremely dangerous in this period. Once you wake up in the morning, you realize that as if there is a reset button that takes you back to depression, and you'll feel you don't want to move. You just feel stuck inside the bed, and you want to stay there for an hour or two and scroll through social media, and this scrolling might even take you to the first trap, which is monitoring. So bed is a big no. Anything but the bed in this phase. When you wake up in the morning, have a system where you have some sort of an appointment with your coach or with a client or with someone who forces you to get out of bed immediately and go to the shower and get out of the house. And generally speaking, I wouldn't prefer at this period to stay in the house. Even when I tell my patients about a plan, I tell them, once you go to work and finish your work, then go to the gym. Once you finish the gym, try to shower inside the gym and then take your stuff with you, go to a coffee shop, sit for 2 hours, read and watch materials related to the damage that has been done to you so that you restructure your thoughts and understand what happened to you more clearly. Try to express if you have a paper. If you couldn't, if you can have a session or you can talk to a friend, as we explained before. But the system I create is that once they wake up till they sleep, they don't go back to bed. I did it myself back then. Actually, funny story, I told the guy who works in the coffee shop, take my keys, don't give it back to me unless you finish your shift. And by that I meant I wanted to keep engaging my mind in something helpful, because I know once I go back home, I might just stay in bed and not leave. Even go through the fourth trap that I'm going to talk about right now, which is sad music. Any sad music might be a huge trigger in this period. So try to avoid them as much as possible. Even one time, it might make you lose a whole day. So be careful. The fifth trap is refusing therapy. I myself am a medical doctor and I'm a very scientific person. Even in medical school, when I talk to my friends about psychiatry, I used to see psychiatry as just more of a drug dealing, a doctor who drug deals, who just sell drugs for diagnoses that are categorizations of human experiences. I hated psychiatry back then. But then when I grew up, I understood that there is some sort of truth to my views, but at the same time, not to that extent, because there is some other helpful aspect in this realm or in this specialty. I used to see psychotherapy as something not real when people told me about expressing emotions, and I'm a scientific person that used to not believe on this stuff. I used to be very logical, very scientific, so the idea of expressing my emotions and talking to someone to feel better and overcome something, that didn't resonate much with me. Till I got depressed at the age of 21. I was severely depressed. I went to multiple therapists and they actually proved my theory. It was just emotional validation and no clear strategy or no clear understanding of my patterns. Then I found someone, a proper mentor with proper content, and she guided me through the whole process, and I realized how blissful I was because of this, because I found someone who actually understood my experience, and I understood that this mentorship process and being her apprentice made a huge difference in my life. In all aspects of life, I became a totally different person. It's more of a rapid psychological rebirth, as Dr. Carl Jung said. The idea of therapy, I know a lot of you now while watching me will be like, oh, this is not something necessary. And I totally agree with you, because a lot of therapists are not good when it comes to actually creating a strategy and making you understand what you've been through and understand your complexes and your mind. But if you found someone who is actually a real expert, who understands what he's talking about, who resonates with you, who accepts you, who pushes you forward, don't be cheap with money. It's the ultimate investment that I did to myself. It is the thing that changed me significantly. Significantly, I mean, I would have never reached what I reached today without going through this process. It turned me from a regular doctor who's working in a hospital who no one knows about to someone who is famous in the Middle East, has more than 1 million followers in social media, and has multiple bestseller books. I left government and I worked in my own independent clinic at an early age. All of this was because of the self-belief that I developed after forming the secure attachment in therapy. I was lucky because the expert was truly and genuinely different. I wish that most of you have a similar experience or try it out to understand. And always remember, experience is king. Go with your experiences. Try to experience things to understand whether they resonate or they don't resonate with you. Don't judge therapy as a concept from one therapist, because especially in this specialty, it's about the person. Whoever is offering it it's totally different than, for example, gastroenterology. If you go to multiple gastroenterologists, maybe they might give you a similar diagnosis. But when you go to therapy, it's not about a diagnosis. It's about delving deep and understanding yourself. So it's about the other person and how much he introspected with himself and how many people he has met and how many experiences he's been going through. Now, trap number 6 is not hitting the gym. And I told you, martial arts, gym, weight training, swimming, all of these are going to be helpful, especially for emotional release. Any form of martial art or weight training will be highly helpful. And when you train weights, you adjust your food. It will be a very valuable process, and it will heal your body from the inside, and the proper nutrition will help your brain to recover from whatever happened, because your brain got traumatized by this experience. This is one thing that helped me with depression a lot. I went and hit the gym, and I was tiny, and it actually helped me in building muscles, maintaining my food. It helped me tremendously it's like more of a painkiller to me, but a healthy form of painkiller. And I urge my clients to find whatever sport they like and indulge in it in this period. And try to maintain a healthy lifestyle thereafter. Try to take whatever is good out of this experience that might help you. The 7th trap is entering a relationship fast. I always tell my patients, it's okay for you to go and meet new people in this period. You might be able to form good friendships. You might engage socially with new people. It will enlighten you. It will help you be engaged in reality instead of engaged with your mind. It's called the active engagement of the brain. The more you engage the brain in external events, external scenarios, the highly likely it will be disassociated and disconnected from whatever is happening inside you. In the phase of overcoming a breakup, when you sit with yourself, you'll overthink, overanalyze, and you might feel stuck. So engaging with people is highly helpful, and social isolation is totally dangerous. Meeting new people is fine, but entering a new relationship and creating a rebound relationship, this is totally wrong. You shouldn't go there. The next trap is trying to get back to the person or take revenge from him. If you let the person take over your emotions and you just think about how to take your revenge, this is just a waste of time. Your success is the best revenge. But comparing yourself to him and where did you reach and where did that person reach is just a waste of time. Wanting for him to come back and you kick him off, this is a lot of patients actually told me this. I want him to come back to me and beg me to go back to him, and then I'll refuse him. I know it will give you an ego boost, but as a thought, as a fake hope, it's a waste of time because we cannot control this process. Another common trap is trying to console oneself with the idea that the other person will regret it one day and he will feel very deep regret that he left me. It wouldn't add to you anything. It's just a trap. And I don't want you to delude yourself. He might be happy with someone else right now. This is reality. I know I'm harsh about it, but this is the truth. Be wary of addictions in this phase, since you have a lot of external pressure, pain, and you might have free time. Addictions, they might try to intermingle and enter into your life. You might be addicted to social media. You might be all of a sudden watching more porn. You might go into shopping binges. Be careful. Try to find, if you go through any addiction, try to find a healthy one at least. For example, training. This is one addiction, or work. It is an addiction, but it's fine to go through it in this period because it's difficult for you to just stop all addictions. As addictions, they just show up and rise in your experience once you feel a tremendous form of pressure. They are more of pain-numbing substances, not necessarily real substances. They might be, as I mentioned just now, other things. So just be mindful, worryful of addictions. Not engaging with people might be dangerous. As I told you before, meet new people, go out, enjoy your time. Even, when I had a breakup back then, I used to just want to go with the friend that helps me in venting off. Venting off is fine to a certain extent, but if you keep repeating it, you might wallow into victimhood and you just feel like you are sad and depressed, and it might make you feel worse. So there is a limit to how much you express. As I told you before, emotional expression is extremely essential and important, but it has to be limited. It has to be within certain confines and rules. Even in the clinic, I tell my patients, if you expressed once, twice, the third time is the last time. I don't want you to keep going back to the same story. Since we analyzed it, we understood what you went through, you understood the attraction pattern, you understood your weaknesses. Now it's time to move on. It's time to talk about something else. So even when you go out, choose even the friends that you go out to have entertainment with, not only the people you want to vent off with. Unfortunately, back then when I was young, I used to choose those people specifically that I vent off for. And deep down inside, I didn't find any need to go with those that they go out for just entertainments or sports or other things. But always before and after the social outing, once I come back from those friends, I would feel 10 times much better, even though I didn't know why. But once I realized the idea of the active engagement of the brain and how the brain, when it engages in new experiences, helps me detach and disconnect from my pain and sadness in a positive way, I kept on doing it and pushing myself into doing it, focusing on myself. This is a trap that you might encounter. You might say, now I just want to focus on myself. And I usually tell my patients, focusing on yourself means now to understand the dynamics of the relationship, what actually happened, why it happened, what were the mistakes that you've been through, in creating essentials and new basics in relationships, and reading more theory into the relationships, not on just focusing on oneself on other areas. Because a lot of people, they go with, let's accept ourselves, let's work on ourselves, and they just go with habits, discipline, doing daily deeds for themselves or self-care, neglecting the fact that it's important to restructure their relationship life and understand what went wrong. So they were like, doctor, why do we waste our time about something that happened in the past? Let's just move past it. But this is not the right way to go. Even once a client comes and he tells me, doctor, I want to get over this breakup, and please, doctor, I don't want to talk about it. Whatever happened, and I want to go to the next step now. So how to focus on myself, what to do on a daily basis, to exercise, to eat properly. Once they tell me this, I tell them, okay, you can go to ChatGPT and just write down how to get over a breakup instead of coming to me, if you want to go that route. But if you want to do it properly, under my guidance, you have to talk about the experience. Part of it, emotionally expressing whatever you've been through. The second part is understanding yourself, understanding the right basics. Because a lot of experiences and situations with the other person, things you did, they were wrong. You didn't know that in the first phase, for example, in the attraction phase, you didn't know that you shouldn't be extra available to the person. From the very first week, you said, I love you. And this is a huge red flag on your terms, on your side. So you didn't know that. So you have to go through the process. So reviewing your childhood, reviewing the complexes and patterns that showed in your relationship, understanding the basics. This is what you should do. Because if you have a weakness in the doorway of the relationships, you have to work on this doorway. Not just ignore it and focus on the doorway of the self. You just go with self-work and stuff related to discipline and routine and habits. This is not the cure. This is not the actual problem. This is not the weakness. This is not where you got hit. The trap of being a harsh critic on yourself. In this period, I've encountered that in many cases I've met in real life, the patients used to tell me, doctor, we are just doing constructive criticism. This is normal. We have to help ourselves. We have to understand our mistakes. But what I noticed that they just keep focusing on the criticism aspect. And if you bring a child and keep criticizing him in a constructive way, he'll become an idealist. He wouldn't be able to see the good in himself. He'll always feel inferior because he always has mistakes. You have to also focus on the positive part, the bright side of you, the good things about you, the things that you did right, the things that you're doing right now for yourself. When people tell me that they write journals of gratitude, I always write journals about actions that I did that reflect self-love for myself today. And this is for me being realistic and practical. Distractions are fine for a while. Movies, comedy shows, reading stuff that you just enjoy, they're fine if they happen to you. So don't over-idealize this process of healing and try to do everything right. You need to let yourself go with some addictions or healthy addictions, or sometimes with distractions. It's fine. What you've been through is actually difficult. You have to not be that harsh on yourself. It's important not to expect honest reasons behind the breakup. There will never be a proper closure from the other side, because people, they might not want to hurt you. They might not even understand why they left you. So instead of doing that, Just focus on understanding what happened. If there is something you want to share with them later on, in the right time, you can after you heal. But during this phase, trying to find answers from the other person, it's just a big no-no. Because, when I was a nice guy, I didn't know that I am having this problem of passive niceness. So when I asked her what happened, what is the issue, she just used to tell me that I don't know, I just don't feel like we are right together, I'm confused, I don't know what is the reason, maybe we are incompatible. So she didn't understand what is actually the problem. She didn't know that because I don't have enough boundaries, I didn't have enough self-assertiveness, I didn't have real substance, I didn't understand myself, I was very submissive. This is the reason behind her leaving me. And this was back then when I was very young, like 15 years ago. But I still remember looking for answers. And this is not the right way or the right place to look for answers. Idealizing the ex is a huge trap. It happens because of your poverty mentality, because you didn't go through enough experiences, because you have very low emotional perception. Emotional perception is built upon experiences. So the less experiences you have, the more likely you think that this is a person that might never come again, or you might never find someone like her. I still remember in multiple experiences before, I used to idealize and think that unfortunately I lost the love of my life, or I lost my soulmate. And this was all not real. It was fake. It was just in my mind because of my lack of experiences. Because when I was younger, I was someone who's just afraid of dating or meeting people, and due to social restrictions, it made it much more difficult. But now I reflect back, I can see that the problem was the lack of experiences. And each and every single patient I meet, I tell them, if you have very few experiences, the poverty mentality and idealization, they will happen, but I want you to go through more experiences to understand what I mean. Because a lot of things, they cannot be reflected by words, especially experiences. Now, I've been through a lot of experiences, so when I tell my client do this or do that, I tell him to experience it himself, because I cannot communicate an experience by words. And this is a huge gap when it comes to analysis, a huge problem that I confront on a daily basis. Don't rush the process. Do not restrict yourself to a timeline for healing. Healing is not a linear process. It's more of a zigzag line. You might go up one day and down the other day. But if you keep maintaining a grounding system and applying whatever I said in the video, you'll find yourself feeling better and better. And by better, I mean, look first at your behaviors. You'll find yourself more functional in the day, more grounded in your system and in your routine. And then your emotions will follow. You'll feel better and more happy and more content. You'll notice that those depressive feelings are fading away. After the emotional phase, the thoughts phase, you'll notice that the thoughts that come about your ex or the breakup are subsiding and are going away day by day. So it's a process. The first phase, the behaviors will change. The second phase, the emotions will follow. Later on, the thoughts will diminish. The last trap is the fake achievement complex. In this period, some people overload themselves with self-help content. And overloading yourself with reading and reading and reading without trying to apply whatever you're reading, without trying to customize it to your experience, this is a huge waste of time. So be wary and mindful of this trap. And now we'll go to the last phase of the healing process. It's the journey towards the self-actualization, soul searching. In this phase, you have to understand that after going through all the phases, the previous phases that I mentioned, and you understood the traps that you might go through, now you have to do the work on the self. Now you have to understand that this can be a very expansive, enlightening experience, and you can make it so. And you can also make it so damaging that it makes you always shrink with fear of commitment, fear of intimacy, fear of closeness, fear of building any relationship, and trust issues that linger and stay. Just remember, in healing, you have to always trust your personal experience and see what works for you. This video doesn't have to necessarily be 100% applicable to your case. You have to see and connect to your emotions and understand whether it's working or not working. And whoever is going through a breakup, I want you to comment down on the things that helped them, the things that didn't help them, whether they understood the video properly, whether they see that there are lacking areas that they can add and expand upon. I would highly appreciate those comments. An important aspect in this phase is focusing on the essentials and the basics in relationships. You made a huge mistake in a relationship, or you didn't understand relationships properly before, so now it's the time to put theory, practice, and find someone to evaluate the practice so that you improve in this specific area that you kept neglecting, that society neglects since we are children, that even the school system never taught us proper guidance on it or proper guidelines on it. So create your own guidelines. There are a lot of people who actually talk deeply about those relationships and dynamics and issues and complexes. Don't go with the superficial talk. Like, for example, a very famous book called The 5 Languages of Love. For me, this is a superficial, simplistic view of relationship. I want you to look at it from a deeper perspective. Find people who know deeply and meet on a daily basis cases that they analyze in depth, they analyze at a personal level. You have to understand first yourself to understand the other person. I focus on this phase upon the fact that filling the emptiness that is dwelling inside you is extremely essential. Because once someone who is deeply connected to you and communicates with you on a daily basis leaves, you'll feel like there is an empty gap inside. Some people, they have this empty gap since their childhood. So to fill up this inner emptiness, first you have to start trying to build bonds, invest in people that actually deserve investing in. Also reevaluate the bonds that you actually have right now, or that you're having right now, whether friends, family members. Try to look through the people you surround yourself with. Ask yourself these questions. Do they respect my boundaries? Do I feel accepted around them? Do I have to explain myself when I'm with them? Do they help me in confronting them about my emotions? Do they assume stuff or confront me with how they feel? Do they apologize when they do something wrong to me? Do they have enough love actions to qualify them as deep relationships? Are they a real added value? So those questions I usually ask my clients. I tell them, just put the names of the people that surround you and put those questions and answer them honestly without trying to side by the person. And here I go through the same analytic endeavor that I did with the ex. I tell them, write scenarios. Let's analyze the scenarios together. Let's see whether you're looking at them from a realistic lenses or you're just exaggerating their importance or their depth in your reality. This will help you remove all sorts of expectations and look at them in realistic lenses. I can't stress the importance of the grounding system. By grounding systems, it means from the name, a system that grounds you, a system that helps you on a daily basis attain all the goals that you want to attain, especially in the healing phase. So a system that helps you build a routine for the exercises you want to do, a routine for the reading materials you have to finish, a time or a scheduled time for self-care. So you'll need to schedule the time. Usually when I say grounding system, it means a routine, a schedule, timed, so that you stick to it. And you try to stick to it 50 to 70% of the time. I don't want you to overdo it. I don't want you to be harsh on yourself. I don't want you to hold yourself to very high standards. It's after all a healing phase. You just get damaged, you get traumatized. So be compassionate towards yourself. Revisiting the concepts of habits is important also in this phase. So you can go through the book called Atomic Habits for James Clear. It's a very good book to re-establish new habits and start cutting down on the negatives, adding more positives in your life. Reading, especially related to what you've been through, is important in this phase, and watching content and scheduling social outings, sticking to the gym. If you just stick to those three, they will help you tremendously. And trust me, from personal experience with thousands of patients, this actually does work. So to fill the empty gap and to have this inner emptiness resolved, first building real bonds and investing in people that you want to invest in. And by investing, I mean you selectively choose whoever adds value to you and try to build relationships with them. This is number one. And cut the people that don't deserve being in your life, or re-establish your boundaries with them, especially after you analyze the depth of the relationship. And I just mentioned how to analyze it through the questions that I offered you. The second thing, grounding system, understanding habits, having a schedule, having a routine, these are essentials. The third thing, seeing and meeting new people. By new people, even in the opposite sex, you have to meet and talk and monitor yourself, monitor your patterns without engaging in a relationship, because it's important in this phase, yet you heal properly, any relationship might become a rebound. Someone might ask here, doctor, I want to be self-sufficient. I don't want to depend on someone else for my happiness. I always tell them, to be self-sufficient, you have to fulfill your own needs, but don't forget that sexual and emotional needs has to be fulfilled by someone else also. So you will need someone to be with, but at the same time, you have to not depend on that person. And this is a huge difference. There is a difference between having your needs met from the other party and depending on it to an extent where if this person leaves, you break down completely. And this is lack of self-sufficiency. So you have to have the terminology for self-sufficiency right. You are self-sufficient if you fulfill your own needs, you try to fulfill the needs from a partner. If you couldn't, you keep meeting new people, you don't break down, you have enough emotional resilience and strength to get over the person and go to the next step. And actually, emotional strength and toughness come from expressing your emotions, not from bottling them down. The emptiness might also be filled if you try to find meaning in a spiritual endeavor or a spiritual quest. If you re-question your reality, your existence, your religion, your country, social norms, and start putting concepts and norms that represent you. Start finding values that actually resonate with who you are. Because a lot of people in this process of getting addicted to someone or attached to someone, they are doing that because they have a lack of sense of belonging. So once they re-question the concept of meaning of life and re-question the dogmatic way they were born upon, they might find it very enlightening, and this experience might help them see life through different lenses and will give them a better meaning to live for. I can't stress the importance of self-care. You have to take very good care of yourself in this period, and I think everyone talks about this idea, and I know that how good it feels if you care about yourself during this period, because you are offering yourself real love. Other than that, you have to learn how to create or establish personal boundaries. The concept of boundaries, I'll create a video about it. I'll explain it in more depth because it has a lot of complexes associated with it. So we'll talk about it later on. The last thing I'm going to talk about in this video is having a goal and how crucial it is to have a specific targeted goal that centers you down to help you go through the breakup process. Why did I say the word centered? Because, having a certain goal that gives you trajectory, this is how our mind operates. Our mind needs a trajectory to go to. So if your goal is, I want to gain 5 kilograms of muscle and lose 2 kilograms of fat, a specific goal over an interval of 4 months, you'll find yourself focusing on everything you eat, reading more about nutrition, watching more videos related to fitness, and indulging in this process as if you want to become a master in it. This helps you in getting over everything, a breakup or any other trauma. But if you just take it from the mindset of the tasker who just wants to do a task, I want to be healthy and that's it, this is not a goal. This is not something that will center you down. This is not something that will help you move forward with a clear trajectory. So it will not help fight your brain when it comes to ideas related to the breakup and why it happened and how it happened and wallowing down on it. Always remember, a goal has to be specific, targeted, that creates for you a clear trajectory so that you fight your mind and fight your brain and get out of your comfort zone. By now I finished the video. I hope you enjoyed the experience with me. I hope you understood how to overcome a breakup. I tried to be very practical. I tried to put all the steps that actually work, everything that I saw in my clinic with my patients. I know that it's a very long video, but I saw that there's a gap in YouTube when it comes to this type of content, especially stepwise approach to overcoming a breakup from someone who actually been there himself and he saw his patients go through it over the years and how to get over it and all the traps that are involved in the process. Anyone who has a question, something to comment on, an addition, you can comment down. For personal consults and appointments, I'll put down a link, WhatsApp link for the clinic. You can contact the clinic. I put my website down, but unfortunately the website, most of it is in Arabic. So for English audience, they can just go through the WhatsApp of the clinic and talk to the clinic, and they know how to speak English. So if anyone needs a personal consult, personal guidance, follow up, I'll always be glad to help.